Well, today is National Doctor Day, and we are joined by Dr. Patrick Joynt from Denver Health's Emergency Department. Doctor, thank you so much for being with us.
Thank you for having me.
Yeah, we really appreciate your time. We want to talk a little bit about, and mostly today, about Narcan. It's been in the news, a lot of discussion about it. You see on a daily basis, of course, the impact of opioids and overdoses being in the ER. So how do you feel about this now being available?
I think it's great. I think it's a great tool for anyone to be able to have and to carry and to be in a situation where they could save a life. And so the reduction in the barriers to get Narcan, which is to say now being available over the counter, I think is going to be a great next step for more people to be able to carry it.
I'm assuming you've used this before.
Yes, so this kind of was spawned from a shift a couple weeks ago where I worked the day in the emergency department, and then walking home here in Cap Hill, I came by an alleyway with two men looking over a guy on the ground, and I walked up and I said, you know, what's going on, guys? And they said, oh, he's not breathing. We've called 911. And so I carry Narcan in my work bag. And so I assessed him. He had a pulse but wasn't breathing. So I gave him the Narcan, did some kind of basic airway maneuvers, and he started breathing again. And then the Denver Health paramedics arrived and were able to safely transport him to Denver Health.
I mean, you're a doctor, you work in the ER, you save a lot of lives. But what was this like for you, walking home and seeing this and being instrumental in saving someone's life?
It was really a great reminder of kind of what a privilege it is to live in our community and to be in that scenario where I could really help save someone and potentially really save their life outside of this kind of normal environment where I have all the tools at my discretion. And then people were already there, of course, trying to do their best for them, but they didn't have the right tools, and I did, and so that was just a great opportunity.
For people who aren't aware of what Narcan is, can you explain it?
Sure. So Narcan is technically the brand name for the medicine naloxone, and naloxone is the antidote for opioid overdose. And so what naloxone does is it essentially competes with the opioids, whatever they are, fentanyl or heroin or whatever it is, at the opioid receptors, and so people then can have their kind of normal brain processes take back over, wake up, start breathing. And so Narcan really is the easiest way to administer this antidote.
And now, well, as we mentioned a second ago, it will be available over the counter. Pretty easy for people to administer because people can just walk in and buy it. Surely it's easy for them to administer.
Sure. Having it available over the counter will then be great, and there's just like, you know, a very simple pamphlet that comes with it. And so I have some here with me, and it really is that easy, which is to say that you just put the white part up the person's nose, push the big red button, and it'll automatically inject the medicine kind of into their nasal cavity where it's absorbed, and that's it.
All right.
Pretty easy.
Well, Doctor, thank you so much for being with us and explaining all this for us today. We appreciate it.
It's my pleasure.
And happy Doctor's Day to you.
Thank you, thank you.
Well, you will be able to find this interview as well as many others at cbscolorado.com, and we will be right back.